Thank you so much, Dr. Archana, for joining us on this event organized by Artemis on Multiple Sclerosis Day. I have few questions on this. I would like to know what are the signs and symptoms of multiple sclerosis and a person feels in starting and then it later goes on when it goes to advanced stages.
Thank you. What are the symptoms and signs of the multiple sclerosis? So what happens is whenever a patient feels that there are certain vision problems, which is the foremost and the most important symptom which occurs in the patients, that they start having difficulty in the vision. That is, there is some blurring of the vision, there might be some diplopia, and there is sudden diminution of the vision which can happen. So first is the vision problems. If you are feeling so, then you have to consult a neurologist. Second is, supposedly you have bladder or bowel problems. You might be having difficulty in passing the urine, there might be urinary hesitancy in the form, there might be urge and you won't be able to stop it. Third, if you ask me, there can be multiple sensory symptoms, like there are some tingling and paresthesia, जिसको चींटियां चलना बोलते हैं, in any of your limb. That can also be a sign and symptom of your disease. Fourth important is the weakness. If you are feeling that you are having weakness in any part of the limb or any part of the body, that is also one of the symptoms. All these symptoms, these are visible symptoms that patient can actually feel them. There are certain non-visible or invisible symptoms as well. These are fatigue. पेशेंट को बहुत ज़्यादा थकान होती है, दैट इज़ वेरी इंपॉर्टेंट एंड वेरी डेबिलिटेटिंग फॉर द पेशेंट एज वेल. सेकेंड इंपॉर्टेंट इज डिप्रेशन एंड देर इज़ अ डिमिनिशन इन द कॉग्निशन एज वेल. Many of the patients, approximately 30 to 40% of the patients, they do complain of fatigue as well as depression. Another invisible symptoms is the sexual problems, which can be in the form of dyspareunia, in the form of erectile dysfunction as well. So these are basically the signs and the invisible symptoms of this disease, which is known as multiple sclerosis.
Thank you so much for explaining this in a very simple terms to our audience. My next question is, how do we proceed for diagnosis, or what is the process for this diagnosis?
So now I have told you about the signs and symptoms of the multiple sclerosis. Now I'm going to talk to you about how do we conclude to a diagnosis of multiple sclerosis. Whenever we talk about any particular disease, everybody asks, is there any one test, is there any two tests by which we can confirm that this is the disease? In this case, in the case of multiple sclerosis, there is no particular definitive test in which we can say, डॉक्टर साहब ये टेस्ट हो गया है और इससे पता चल गया है कि ये multiple sclerosis है. It's not like that. So we have to go through a panel of tests and we have to go through a lot of examination and detailed history as well. The first and foremost important thing is that you have to take a very good detailed history as well as the clinical examination. Second, all these things, there are certain tests which can aid, that can only help in the diagnosis of multiple sclerosis. Like for example, MRI of the brain, of the spinal cord, or of the orbit, that is your eye. All these symptoms and MRI can actually detect whether there is any active damaged cells, neurons, or any chronically damaged, means there was a remote injury in the past and all these damaged areas can be picked up by the MRI. Second test which we can do is the spinal tap test, which is also known as the lumbar puncture test, in which we actually drain a certain amount of CSF, that is the fluid which surrounds the whole of the brain. And by testing this, we can actually conclude that this might be multiple sclerosis. This is also not definitive. We can just help कि it might be multiple sclerosis. Also, it is very important to rule out certain mimics or infections which can present like multiple sclerosis. Like there are certain autoimmune other diseases as well which can present in a similar fashion. Third, we can do and we can go for some visual evoked potential test or BERA test. In these things, nothing is done. There are simple two tests in which your hearing and your vision, both of these things are checked, because in multiple sclerosis there is defective transmission of the nerve signals. So all these tests will be prolonged. And finally, and most important, is that it is a diagnosis of exclusion. Once we have done a detailed assessment, we have done all the tests and everything has come out to be negative, then only we can conclude that this is a multiple sclerosis.
Thanks a lot, ma'am. You explained us in a very well manner, and thank you for sharing your insights and experience with us and our audience. It's very helpful. Thank you.